Hello everyone, welcome to an episode of TooHealthTalk, a show where we talk about real health challenges and get to break it down in a very simple and honest conversation. On today's episode, we have a special guest, but before we continue, please, for you to know what we're doing here, please subscribe, share this video, and like, and share your comment in the comment section. Back to our guest. On today's episode, we're going to talk about a very peculiar topic that most people don't talk about. It's been like trending for the past like 2 weeks or like a month now about this particular topic. And so excited to have our guest doctor to talk about this topic. We have Dr. Abass in the studio with us today. So we're talking about pentazocine. Am I correct, guys?
Yeah, pentazocine.
Yeah. So this injection is like one of the most abused medication I think around the world.
Around the world. Yeah.
So now for our viewers that are just hearing this stuff for the first time, can you give us a breakdown of what this medication is all about?
Yeah. So pentazocine injection, for example, we call it some people call it penta, is a prescribed opioid-like medication. And it's given to patients who are having moderate to severe pain, usually for a short duration of time. And like I said, the word prescribed should be underlined there. So it has to be prescribed, given for moderate to severe pain. And after then, you move on to another step of medication. So it shouldn't be taken for a long period of time.
Yeah, so now, like, when is this drugs being abused?
Okay, now, so the drug is usually being abused when the prescribed duration has elapsed and you keep on taking it. So if you are prescribed to always take penta for like, let's say, a duration of 3 days, and you now keep taking it for like a month or two, then you're abusing the medication. And like I said, it's an opioid medication, so it's prone to addiction. So if you keep taking it, you get addicted to it, then you have to continue taking it. You are now dependent on the medication.
So now it's somewhere where this medication, you said this medication is for pain, like kind of a pain relief medication. Now, when it becomes like, how does it work to become like addiction? Because I'm wondering how you take pain relief and it become addiction. Like, why is this particular medication like this?
Yeah, now when we're talking about addiction, we're talking about like you're getting an edge of something. So most patients that take pentazocine now, they are in severe pain. Let's give an instance. People that have sickle cell, for instance. Sickle cell pain, we in the medical field describe it as the worst pain of their life. So they are usually the ones that can tell you the level of their pain threshold. So when you have to take penta and it relieves your pain, like I said, it's short acting. So it goes off, it wears off. So if you take the medication now and it wears off and you feel the pain comes back again and you need to take another dose to wear off that pain again, it gets to a level your body get addicted to that level of pain, then you need another dosage of penta to wear off that amount of pain again. So you reach a threshold, you need to increase the dose, like that. It's like a continuous cycle, and you need to always increase the dose.
But like I've seen people that are not sickle cell that take this medication.
Yeah.
Why is this so?
Yeah. So like I said in the definition, it has to be moderate to severe pain. So mild pain that you can take paracetamol, PCM to take off, cocodamol to take off. Some patients, you have to, maybe like for instance, you have an accident, for instance, with bone fracture, with severe injuries and all that. Those pains are usually very significant. So you need a medication that will significantly drop the level of that pain, and that's where penta comes in.
So now I've seen where someone talk about taking penta and there's flesh eating, like one side losing flesh, and also how does that work?
Okay, so the word flesh eating basically means tissue damage. So it's an IV medication. So you have to inject it through your skin. Now, when you're injecting IV medication, that means you're targeting the blood vessels around that region. And what do blood vessels do most of the time? They carry nutrients, they carry oxygen and all that, supplying all over our body. You get blood vessels are everywhere. So when you take penta and you inject a particular site, you're basically causing tissue damage at that point that you're injecting. Now, normally the blood vessels around that region, what they do is that they carry healing factors to those areas and heal that wound. Particularly, but if you keep injecting penta to that particular location, can cause damages to those blood vessels, limiting the blood flow to those areas that you keep injecting. And with time, infection enters that place, abscess form, before you know, tissue damage, and at that point at that area is no longer healing. So you see that the wound starts breaking down, and it's like as if flesh is eating off that particular area. So that's why you call it flesh eating. It's not as if the drug itself is eating your flesh. It's just that the persistent use of the drug is causing reduced blood flow to that particular place, and reduce healing at that particular. So the more you do it, the more ulcers are being formed around that.
So now, are they like warning signs that okay, this stuff might it's my flesh, or I might get addicted to this
Yeah,
stuff?
they are warning signs. So earlier stage, like I said now, due to the fact that you continuously use Penta, you notice that the point that you're injecting, you start noticing signs of inflammation. For instance, you start noticing that the place is always hot, is red. With time, you notice that there's now a wound crater forming around that region. Before you know it, start forming abscess and pus start coming out from that area. When you start seeing things like that, you're obviously not normal. It's not normal. So you should go to the hospital at that point in time and complain about things like that. But you know, some patients will continuously, because now they're addicted to it, so they now have to continuously jab other areas of the body, causing the same wound that is happening in that particular area in other areas of the body.
I do think it's like poor injection techniques that might cause those.
So now, so poor injection technique, yes, can also be a cause. Like I said, is an IV medication. So it must go intravenous. When you say something is IV, we have IM, we have IV is medication. IM is intramuscular. IV is intravascular. Now it has to be through the blood vessels. Some patients, it's not everybody that is trained in the medical field to know where your veins are. Sometimes you even have to tie to see the veins very well. So some people don't actually know what they are doing. They just took it and sometimes they will inject it through the muscles itself, and which can also cause tissue necrosis around that area of the muscle as well. Now, IV medication, if you keep jabbing it, like I said, these blood vessels, they're also tissue-like. They're also tissue, so you can damage them by reducing blood circulation towards that particular vessel, causing damage and all.
So now, can you talked about this stuff affecting the tissue? Can there be any point where it affects the tissue and it does not affect the skin?
No, because for you to get into the tissue, the skin too is also a part of the tissue. Do you understand? It's
Yeah,
just like a
true.
large organ. Do you understand? So there's no way you inject yourself and you not pierce your skin. Do you understand?
So now, apart from Penta, are there any other like abuse, like
Abuse medication.
Yeah.
Wow, there are a lot of. There are a lot of medications that are abused generally. Generally, opioid-like medications are abused. We have cocodamol. Cocodamol is like an opioid as well. It contains codeine. Do you
Yeah.
understand? People abuse it a lot. We have Penta. We have Tramadol. Tramadol is widely abused in so many areas. Like we have
True. Like I think tramadol is even more
yes,
popular. Yeah.
yes, more popular. Like you go to, permit to say, go to places like the northern side of Nigeria now, you see a lot of people taking tramadol, you see a lot of people taking refinol. You understand? A lot of medications are really addicted. And the problem with addiction is now is controlling it. Do you understand? So a lot of people don't know when to stop once you've started. And what we miss out is we manage the patient's condition. We don't manage the addiction itself. So when the patient comes with things like, oh, I'm having wound abscess, wound breakdown from taking tramadol, that you want to heal the wound, but you've forgotten what caused the wound in the first place, which is usually the addiction itself.
So now, how you've been in the public health space for a while. So how were you able to like? How can you control addiction? Or if someone comes in with like something like this addiction now, how will you able to advise the person on like addiction?
Now, so the thing about addiction is that addiction is in two phases. When you want to control addiction, it's in two phases. You have to first help the patient and limit the availability of what they are addicted to. In Nigeria, for instance, now, when it comes to our drug control scheme policy generally, somebody can just walk into some pharmacy and get this medication. Do you understand? So the availability of this drug should be scarce. That's why I say in the definition that I gave, I use the word prescribed. These drugs have to be prescribed to patients. Now, you even see that most hospitals now, some patients even have the prescription sheets. They write it themselves. Do you understand? So
Yeah,
there's
true.
a lot of things. And in the patient aspect of it too, if you're going to help a patient with addiction, number one, they have to be in rehab centers. We have to have rehab centers. Number two, these rehab centers we're talking about must actually be doing the job rehabilitation.
True.
Yes, sir. I've been to some rehab centers where the things that they're trying to prevent the patient from having is available to the patient. Do you understand? So that is a whole lot to contain addiction. Do you know? It's not just something of telling somebody, oh, stop doing this thing. It's bad for you, blah, blah, blah. Most people will not even listen to you when you say that because you've never tackled the underlying issue. Why was he addicted to it in the first place?
Oh.
Yeah.
Yeah. So now I saw somebody. There was a post I saw when someone was talking about how he was taking pental and like was showing the wounds and the
Yeah.
different of wounds. I don't know if you saw.
Yeah, I saw that.
Yeah. So now, that particular one now, can there be any healing? Like, apart, can that one be healed,
Okay,
or
now,
is like a permanent?
okay, now, so like I said, we have different mechanism of wound healing. Some animals, for instance, heal by regeneration. You've cut one limb, it grows back another. We humans, we heal mostly by fibrosis. Like I said, so for instance, when there's necrosis or dead tissue in our body, for instance, our body doesn't automatically bring back this flesh the way it is. It heals by fibrosis. So fibrous tissue will form in those areas, forming like his own, for instance. Now you notice that his limb didn't return back to, even though he's now normal, and all that, his limb didn't return back to the way they looked because some of those tissues are dead already. Do you get? So the body will just replaces it with hardened, thick skin. We call them like fibrous tissue. So just occlude those areas. Do you understand? It will never be the way it was in the beginning. Do you get? That's how our body is. Except maybe our liver, for instance, that it generates. Do you get? And even that one too, it has an extent to which it regenerates up to. Do you understand? So we're not born like fishes and all that lose a limb and it goes back the way it was.
Well, so now if you want to advise someone now that is into addiction and wants to leave, for me, I think addiction is one of the difficult things we human
Yeah.
like see in our daily life, because what is that one advice you want to advise somebody that, okay, this is the way you have to leave this medication or this abuses or this something that you're so addicted to?
The number one thing I like to tell people is the fact that if you want to get off addiction, you have to know that you're addicted to something. Yeah, you see a lot of people taking a lot of things and they don't even count it as addiction. How do you know that you're addicted to something when you cannot do your regular day-to-day activity without that particular incident? You want to go out, you have to do this first. You want to eat, you have to do this first. You want to do this. That's addiction. You can be addicted to so many things. You can even be addicted to behaviors. Do you understand? There are behavioral addictions. Do you understand?
Sure.
But if you have a particular medication that you know you are addicted to, and you want to get off it, the first thing you have to do, number one, know that you're addicted to this medication. The moment you realize that you're addicted to this medication, know your triggers. What triggers you? What particular circumstances in life triggers you to use these medications? And that's where rehabilitation centers come into play. Do you understand? Availability of this thing, is it readily available to you? If it's something that is readily available to you, how will you limit the availability for yourself? So rehabilitation centers, this is where they come into play, because it's not easy for you, one sole human being, to just say, oh, he wants to do this by himself. Family support is very important. Somebody's addicted to something, that's not the time for your family members to now turn a blind eye and not pay attention to you. That's even the time they should pay more attention to you and really help you get over addiction. Because most addicts, what you realize is that there's this feeling of, there's something addiction does to you. It makes you feel a bubble. It keeps you in just your own bubble. Do you understand? It doesn't want intruders and people to enter that bubble. So the moment people are able to penetrate that bubble and show love and show support, you notice the level of addiction really reduces drastically.
Well, so now, apart someone that is having this issue now of taking Penta, is there any other, like say, if I don't take Penta now, is there anything I can take that's not like abuse that will be able to make me, feel normal?
So that's the thing about this medication. You have to first understand, what is the medication giving them? Is it relieving the pain, or is it relieving a particular situation in their life? Maybe they are depressed, and when they take Penta, they feel elevated. Do you understand? You need to understand that. Are they in pain? If they're in pain, are there other medications that you can give that cannot easily be abused and can also suffice the function of that pain? Do you understand? You need to be able to tackle what that particular thing is giving them. So if they're in pain, and is this Penta they have to take for that pain? Is there something else I can give this person that will also take away this pain without having to be Penta? If you can figure that out, fine. If this person is always depressed, is when he takes Penta, he feels elevated. Do you understand? Okay, are there other things we can do to make this person happy? Do you understand what I'm going to? Are there other things this person can do to while away that time of? So the moment you can replace something with something, most addicts stop. The problem is finding how to replace it and finding what it is that you are replacing. Because it's one thing to say, I'm giving you drug, and what's that drug doing to you? Do you understand? Most of them, not as if they want to prick themselves medication and all that, but there's something they want to just take away.
Sure.
If you can find that thing that they want to take away, and you can replace it with something else, basically solve most of the issues with addicts. Do you understand?
Yeah. So apart from flesh eating, is there any other medical condition or damage that Penta causes?
Yes, a lot. Apart from the fact that it's a medication, it can damage your liver, it can damage your kidneys, it can damage your brain cells as well. And apart from that, it can cause some serious mental issues. Mental issues. That's why number one, addiction is a mental issue. Just let's put it out there. It's a mental issue. Some can cause some drug-induced psychosis in them. Do you understand? They misbehave and all that. Apart from the clinical side of it, let's look like the non-clinical side of his financial situation. Some of them will go seriously broke because now they have to be buying these
Buying it,
drugs.
yeah.
And Penta is not cheap, to be very honest. Penta is not cheap. Yeah, so you know, having to get, they will lie a lot to their family members to get money to just buy this drug, lie to their friends, lie to a lot of people. In fact, some of them will sell their properties just to be able to buy these medications. Do you understand?
Yeah.
So there's the social cultural aspect of it that we've not even talked about in any way, what it really does to family members and people around them. Then there's the clinical aspect of it in which the end result ultimately can lead to death.
True. So now, for family now, for parents now watching this video today now, if they are going to like look at their child, is there any like suspected attitude you would suspect? Okay, this person is on drugs.
Okay, now for instance, now let's have it. Let's say you have a relative now that is just always telling you he's in pain, and when he's in pain, he needs this particular medication. Say, give me this drug, give me this drug. Obviously, I mean, you should start suspecting such person that why is it every time that you are in pain is this particular drug you're asking for, or he has to be lying that he's in one financial situation or the other. Today, something has spot, he needs money for something. Tomorrow, he needs money to get something. Well, why are you always needing money?
Money, yeah,
Yeah,
true.
you put your mind into, you have to focus on it, or is always hiding. You're looking for him, he's hiding somewhere. He's always, so most of them are usually, like I said, it keeps them in the bubble. Most of them are always the social aspect of them, they now practice social distancing. Let me use that word. You get, they are now always separated from people. They like to be alone. They like to be alone. They want to stay in their own house alone, lock their door and all that. Once you notice that this person normally is not that kind of person, he's a joyful person, he likes to mingle with people, he likes to play around, you understand, he likes to go for parties and all that, all of a sudden he's locking himself in the house, he's socially distant from every other person, he's lying a lot, you ask him something, he looks for a way to divert the question, and always asking for money for this and that. Those kind of people, you have to really take note of them and suspect them more and want to know what's going on in their life.
So now, lastly, before we go, for someone now that that have been addicted with this pental now, I want to change, like maybe come across this, I want to give the life to Christ.
Yeah.
Is there any way is there like maybe a plan or something you can like, advice you can give them on how to like, stay away from these drugs?
Yeah, so number one, I always tell people that getting over addictions can be very hard. And the one thing I will say is that if you made up your mind that you want to get over an addiction, that's the first step. Like I said, knowing that you're addicted to something is the first step of curing addiction. Because you can go for life and not know that you're addicted to something.
True.
So the first step of getting over an addiction is knowing that you're addicted to this thing. Now, the second thing you need to know is that, why am I addicted to this thing? Is there a particular situation or something that I'm trying to not focus on or trying to just overlook that's making me that I need to take this thing to just get it off? If you can figure that thing out, be a financial problem, be a family problem, do you understand? Being physical problem, like you have pains or something, then looking for alternative solutions to that thing. If it's family problem, do I need to talk to my family more? Is there somebody in my family that I need to settle with? Do you understand? Is there a group or a community that I have to join to just outgo this? Is it depression? Are you depressed? Why are you depressed? Is there something particular? Most depressed people don't know they're depressed. To be very honest. Like I said, most Nigerians are depressed and we don't even know. Do you understand? Do I need to mingle with people more? Is it that I can't make friends? Is there a particular body dysmorphic feature that I have that I'm so conscious about that I don't want people to see me as? Do I need to be in a particular community of people that also have the same condition? Do you understand? Join committee, rehabilitation center. Like I said, rehabilitation center is just not a building. It's not just a building, it's a group of people. Do you understand? You don't have to go to a particular building to be rehabilitated. Your family can be a rehabilitation center. Your friends can be a rehabilitation center. Where do you feel safe? Do you understand? Who are those people that you talk to a lot, that mentors? Who are those people that have gone through this before and have come out from it? You can talk to them. Do you understand? Yeah. Addiction is a very big concept.
But someone is saying that, like I saw a post here, someone is saying that health workers like you are accomplished.
I'm telling you. So when it comes to health workers, I used to put it into two categories. Sapa. So you have the Sapadarians and the people that are just evil. Now, Sapadarians in the sense that now, permit me to say, the money that most health workers get for the job they do is not even, for the job they do and the money they get is not, you can't put it together. They don't make sense. So what most people do is that they look for, like we say, side hustle. to buffer up that thing. And now, having an addict that is willing to pay any amount just to get a drug that is readily available to you as an health practitioner, do you understand?
Yeah.
That's where we have the problem.
Oh,
Do you understand? This drug is readily available to this person. You have the funds to give this person. This person needs funds for it. That's where the problem comes into play. You understand? So now you are trying to meet an end mean while causing trouble to this other person. And this person doesn't really care because he will pay you for it. And a drug, let's say, is 5,000 in the hospital, but because you know this person is desperate to get it, you will call it 200K. This person will look for the money because he's addicted to it. Not knowing that you are causing damage to this person. Then we have the other non-Aquadarians who are just pure evil, just want to see human beings just spiral down the drain. You understand? I really don't understand that concept. You understand? But then we have this again. I won't even deny that some health practitioners, the health practitioner doesn't have to do with just doctors. We have even pharmacists, chemists that just give this drug. In fact, they will even be calling the person, bro, you've not gotten your this thing this week. Oh. Even if the person is trying to quit, they are just those devils that will always call you and say, oh yeah, come and collect this. That's like we have this new one in stock, it's just arrived. Like that's pure wickedness. You're trying to make profit and at the same time you're causing damage to somebody. It's a really big problem.
what's your advice for them, for the health workers?
The health workers, the only advice I can give is God is watching you. It's the truth. God is watching you because come that day, that rapture day, it's you and your God. Oh. Do you understand? You will have to answer to all the evil things we're doing eventually. But
So generally now, before we go, is there any general advice you want to advise to everyone that's facing through any addiction?
yes. So, like I said, addiction is a broad term. You can be addicted. It's not because you had somebody's story that's addicted to Penta and you think, oh, that one is Penta. Look what it's doing to his own body. What you are addicted to, you don't know what it's doing to your own body. Do you understand? It might not be physical. It might be emotional. It might be psychological. Do you understand? If you know you're addicted to something, the number one step is that you know you're addicted. Know why you're addicted to this thing. Seek help. You can't do it alone, to be very honest. You can't talk to somebody. The moment you voice out that, oh, I'm addicted to this and this, you will be shocked that there are a lot of people around you that will feel that comfort that you said your own. Let me say my own to you too. And that's how a community is formed. Do you understand? So seek help. Talk to people. Talk more about your addiction. Don't be ashamed. Everybody, we're human beings. We're biologically wired to experience life. How you experience life and how I experience life is very different. Do you understand? So this the more we communicate with ourselves that we'll figure out what our own problems are. Don't hide things that are wrong with you. Don't hide limb deformity and all that due to what you are causing harm to yourself. Talk to somebody about it. And I feel that's my best advice to people. The more we communicate among ourselves, the better for us.
Thank you so much for coming on the show, Dr. Abass. Like I've learned a lot about addiction, getting to hear them from you today, and I hope that our viewers have also learned one or two from addiction from you. So please, if you watch up this moment, thank you for watching up this moment, and for it to go what we're doing here, for it to see more doctors come on the show, please subscribe, like, and share this video to someone that might need it. See you in our next episode. Bye.